Shui, much of our practice is, as you said, now guided by clinical-based medicine, and rightly so. A lot of us, wherever it is we are in the world, are sort of looking at clinical practice guidelines. And in some cases, we actually look at clinical practice guidelines from other regions as well. What do the clinical practice guidelines in China say about managing cholesterol and lipids generally in patients who've had a stroke?
Yes, in the last year, 2021, we have just updated the guidelines for secondary prevention of stroke. So the target, I mean the LDLC target for stroke patients is 1.8 millimole per liter. So I think, in my opinion, it is conservative. So in my practice, I will give more aggressive therapies for the patients, especially in patients for the patients with large artery atherosclerosis. And so I think for Chinese stroke neurologists, they will give aggressive statin therapies or other lipid-lowering therapies for the patients. But for general community physicians, they may not be familiar with the stroke pathophysiology, and they may not get the guidelines to give aggressive lipid-lowering therapies. So that's my impression. So as far as I know, in China, the PCSK9 is paid by the government since 2022, this year. So I think it is a good news for Chinese neurologists. So they have another weapon to give the patients to have a more aggressive lipid lower effects with these drugs.
We have a similar situation in Australia. The interesting thing in Australia is that I'm not sure if I'm going to get this right, but I think about 3 years ago, the Stroke Foundation of Australia, together with leading clinicians, came up with what they call living stroke guidelines. So instead of waiting for a 3 to 5 year cycle to update your guidelines, as soon as new evidence comes up, that evidence is put together and then sent out to a select number of experts who work with the guidelines team. And then they say that, yeah, I think based on this, we can now upgrade the guidelines. So similarly, last year, the treatment guidelines or the treatment targets for total cholesterol and LDL cholesterol were stated as being 4 and 1.8 to 2 respectively. So I think I'd agree with you that, maybe the treatment target might be a little conservative, but I guess that, that's what we're aiming for at this point.